Welcome everyone to the Lifebulb educational series focused on IBD, inflammatory bowel disease. I'm Karin Hehenberger, I'm the CEO of Lifebulb, and I'm joined here today by a fantastic group of experienced and well-recognized women. I'm going to let them introduce themselves. And first I want to introduce my co-moderator, Tina Aswani Omprakash, as well as our panelists, Stephanie Brenner, who's a social worker, as well as Dr. Megan Riehl. And I'm going to give the floor to Tina. And just before I do so, I just want to emphasize that we have received a number of questions that we're going to aim to answer. And we are also welcoming questions from the audience. I will be reading them while they come in and trying to get answers for you. It's meant to be a very interactive session focused on how to cope and how to build resilience as you're living with IBD, and really across the journey from diagnosis through long-term management, through ups and downs with the disease, through the years also, since we know IBD can often be diagnosed in young age, and through life as it takes us. So it's a very important topic, mental health and how to build up resilience and coping skills with this disease that is chronic. And we have true experts here today. So Tina, with that, please, a few words. Most people know who you are, but briefly.
Hi, thank you so much, Karin. My name is Tina Aswani Omprakash. I'm an IBD Patient Advocate of the blog ownyourcrohns.com, and also president and co-founder of South Asian IBD Alliance, a 501c3 charity. Thank you so much for having me here today. I'm very excited to welcome Stephanie and Dr. Riehl to talk to us a little bit about, such an important topic, mental health. And mental health covers such a wide gamut of important topics for us as inflammatory bowel disease patients. Many of us are struggling with anxiety, depression, but also coping with this condition as a long-term condition. Many of us are diagnosed young, and to become resilient is very, very challenging. And to learn those skills is very, very challenging. So I'm excited to welcome Dr. Riehl and Stephanie today, and I'd love to have you both introduce yourselves. Stephanie, please go ahead.
Thanks so much, Tina, and thanks, Karin, for inviting me to be a part of this. I'm really thrilled to be here. My name is Stephanie Brenner. I have a private practice outside of Chicago in Evanston, Illinois. I'm a licensed clinical social worker. The name of my practice is Chronic Illness Psychotherapy, and I see kids and adults with various chronic illness issues, especially focusing on GI disorders.
And Dr. Riehl?
I'm Dr. Megan Riehl. I'm a licensed clinical psychologist, and I specialize in working with patients with gastrointestinal conditions. So I am a GI psychologist, and there are about 400 of us around the world that have this specialization in GI training. And as many of you can attest, that's not many for those that have GI conditions. And so I run a GI behavioral health program at the University of Michigan, where we see patients that are working with our gastrointestinal team. And I also am a part of several national organizations focused on GI conditions. And I really enjoy interacting with patients and our amazing patient advocates. So it's a pleasure to be here today, and thank you for including me.
Thank you so much. And I'll ask the first question, and then I'm going to let Tina take over. But I just wanted to really set the stage and really asking all three of you, what is the right time? When is there a right time for a patient with IBD to seek help for their mental health? Is it when there is a crisis, or should one, what I've often learned from our experts in our team and so on in mental health, is that one should build our toolboxes while we are feeling healthy. So in IBD, when you're diagnosed, and it's so complicated with the medical portion, the physicality of it, it's really truly a physical disease in many ways. When is the right time to try to build up that mental strength, and do people really have those resources? And if not, where do they go? So Tina, maybe to you first.
think that's such a great question, Karin. I think that upon diagnosis, a patient should absolutely be referred over to a GI psychologist or social worker. I think that was one of the things that was very, very difficult in my journey specifically. It's very hard for many people of minority groups to seek mental health care. It's hugely stigmatized. So I do want to touch on that a little bit, and also ask Stephanie and Dr. Riehl their thoughts about, how do we get this to be more inclusive? How do we make sure that patients are being referred out? I don't think many people realize that there is a GI psychologist specialty, to your point, Dr. Riehl. And how do we keep getting that word out? I just wanted to put that out there for the both of you to answer. Dr. Riehl, if you'd like to start.
I think about patients as being newly diagnosed, usually for the first 3, even 5 years of their diagnosis.
Mm-hmm.
And so it's each person's journey is their own, but it can take several months to years to get an accurate diagnosis of IBD. And so a lot of mental energy is often going toward that. Maybe you've been sick, obviously you've been sick, but your diagnosis can come at lots of different requests of what medications, this is the medication we're thinking of. How's your sleep? How's your diet? How's your nutrition? How's your, and mental health sometimes gets thrown in there, but sometimes it's not the priority. And if physically we need to get you stable, of course, that's going to be the priority. And so thinking of that referral to a mental health provider might not be the first priority, and you might not be in the mental space to kind of dive down that road. But now that we do talk about GI psychology and mental health a little bit more, we're still working on getting our GI docs, to talk about it and bring it up with all patients. And that gets to your point, Tina, it's kind of similarly with disordered eating. Just because somebody's skinny doesn't mean that they're healthy. And so we should ask about nutrition in our GI conditions. We need to be asking everybody about their emotional health, and doing so over the course of that first couple of years, because needs are going to change. Stephanie, you're an expert in this as well. So, I think you can take it from here in terms of guiding people.
Yeah, I feel like the earlier the better is key, so if you can get it, if you can find out that there are supports like this, the earlier in your diagnosis, or even the process of getting a diagnosis, the better. I mean, a lot of GI practices are moving towards this integrated care model where they have someone like yourself, Dr. Riehl, embedded within the system. That's great, because it also decreases the stigma of like, oh, I get this one-stop shopping of my GI, I have my mental health provider, I have maybe a nutritionist or dietitian, and it's that feeling of like they're treating the whole person and not just my illness. So ask your doctor if you're a patient that wants that and doesn't know if your hospital be proactive and ask. I would love for all the GIs to make time and prioritize this, but they are very busy people. And you might end up having to look outside the system. Not all hospitals offer this. I'm in private practice, so I get a lot of referrals from some of these GI providers that have these long wait lists, because once patients find out, they say, of course I would want this help. Like, this is so great that my doctors, you can help me make decisions about medicine or surgery, or there's so much that goes into it. So if you are a patient who wants that, one other resource, if you have to look outside, is called roamgipsych.org. And it's just a website, and Megan and I are both involved in this organization, where it's, kind of like a directory where you can search for providers that actually have this.
It brings us to one of our, the question from our audience that just came in. If you are situated in a place where you may not be able to reach Dr. Riehl or you, Stephanie, and I want to understand the difference also, and maybe we can talk about that next. But can you do a virtual visit? Can you do, is it linked to your insurance coverage, or is it linked to location? How do you make sure you can get the right treatment if you are situated in a place where there is absolutely no one who has this kind of competency?
Yeah, so we have, we're a growing network, and Rome Gastro Psych is probably the easiest place to go to see if there's a GI psychologist or mental health expert in your area. We can only offer services in the states that we are licensed. So there can
That's the key.
be
Yeah.
licensing restrictions. At least, for myself, I only can see patients in Michigan. The insurance coverage is also can be very state dependent. So I see patients with private insurance as well as Medicaid and Medicare. Government payer insurances are covered benefits to see a psychologist, but that can vary by state. So luckily in our state, we have pretty good coverage. And so the other side of this is that I focus almost entirely on helping patients with the management of their GI conditions. So if somebody's coming to me and they have more severe symptoms of depression or anxiety, or are really navigating a variety of psychosocial stressors, I would refer those patients to a general mental health provider as well. So it's not uncommon for a lot of the patients that I see to have a general mental health provider that they can talk, about all aspects of life with. And then they're also seeing me maybe once every other week or once monthly, or as things come up, to really hone in and focus on the GI specific factors that can contribute to one's mental health, and also the management of their GI conditions. So we can get into this a little bit further, but we offer very gut specific strategies to help with the management of symptoms that's a little different from more general mental health treatment.
So now we've pointed out general mental health. We've talked about the gastroenterologist, probably the nutritionist, the social worker, the licensed psychologist. There are a lot of people involved in this treatment regimen for the IBD patient. How do you have time to do all these visits if you're also keeping a job, Tina?
That's a great question, Karin. I'm not gonna lie, for a while, like when I was undergoing surgery and going through a lot of challenges with my condition, like we have to remember, with some of these medications like biologics, you need 3, 4, 5, 6 months to try some of these medications, see if they work. And it really wears on you as a patient every single time a drug doesn't work for you. And that's been the case for me. I've had to take a lot of time off from work. And one of the reasons why I do patient advocacy work was to bring myself back into the fold and get myself to start volunteering again and help a community that's helped me so much. Once I came into remission, and I think it's very, very important to realize that, many patients can't keep up with those appointments. Even today, I'm coming right from pelvic floor physical therapy. It's one of those things that I need as maintenance for my gut health and for my pelvic floor health. And it's just something I've accepted as I need to fit this in. And I think that's what patients also need to get to, a place of acceptance, and mental health therapy is extremely important for that. I think acceptance was a tool for me that allowed me to realize, okay, I'm not living in the hospital anymore, Tina, but you need to do certain things to maintain your health. And one of those things for me is mental health therapy. Another thing for me is seeing my dietitian every now and again. And, virtual appointments do help with this. And I want to stress this, we think about our time in today's world, we think about everything in terms of time and money, right? But this is an investment into your health to consider, to consider multidisciplinary.
Nothing more important than your health.
No,
that's
nothing
else
one priority. And so I would like to actually ask you, Stephanie, how do you teach patients some of these coping mechanisms? I know Dr. Riehl went into that there's gut directed therapies, that there's mental health therapies. What are some specific ways that you both work on patients to teach them how to cope and teach them resilience? I'm just curious to hear your thoughts from both of you. Stephanie, if you don't mind starting.
Sure. Yeah. Even hearing you talk about giving back in terms of advocacy, I mean, that is one strategy that we kind of work up to in terms of finding community finding that those social supports, whether it's through just even passively watching a webinar like this and taking in the information, but finding a support group, finding a licensed mental health provider, and then also finding ways that you can mentor or give back to the community in some way can be really, really empowering. But when you're first starting out and just starting to tune into like, okay, how am I coping with this new diagnosis? One of the things we have people look at is their self-talk. So using strategies like mindfulness and cognitive behavioral therapy, it's trying to see what are the messages or the stories that you're telling yourself about the body frustrations that you're going through. So working with the emotions, seeing if you can find any cognitive distortions, and really having compassion and patience with yourself, because it does bring up so much for people as they have to face a diagnosis that is forever. Mindfulness is a great tool to just begin to notice non-judgmentally with compassion, to kind of just try and accept that this is the reality, but there are pieces, if you think of a circle of control, there are pieces within that, and then there's going to be stuff that you can't control as well. So really trying to tease that out with patients so that they feel heard and understood, but also empowered that there are some variables they can shift as well, like diet, exercise, social supports, meditation. There are some like lifestyle choices that really do help.
So in my simple experience, and I come from a different world than the IBD world. I mean, the transplant world more, but still, social workers have a huge role, across healthcare. But it seems here that the social worker and the psychologist are somewhat coming together, in a way that is really complementary. I always thought that social work was more about the outside of the person, trying to make sure that the person can relate to the outside in a healthy way, while a psychologist was dealing with the inside and dealing with it, how the person maybe relates to the past and so on. Am I wrong, or both of you, both Dr. Riehl and...
No, I would say that's really, I would say that's probably, from my perspective, that's probably our training and our background as the social worker thinks more of systems, resources, and like but I know that within psychology, they also talk about like the person and the environment, the biopsychosocial, spiritual perspective. So I view it as pretty complementary. We just have kind of different language and training. We also bill differently, there's different, if you want to be, in academia, you might have different preferences. So it just,
but if I'm a patient,
like
if I'm a patient with IBD and I'm feeling really overwhelmed, and I, as Tina said, the drug, I'm now resistant to 2 drugs, and I can't really keep up with my job because I have flares, and I'm overwhelmed. My family's breaking apart. It's everything is bad. Where do I go? Do I go to a social worker, or do I go to Dr. Riehl?
I think what you're observing, Karin, is the role of a social worker in a hospital setting does tend to look a lot different than what Stephanie does in an outpatient practice. So Stephanie is very trained. She's capable of doing more psychotherapy and mental health work.
The two of you are much more similar.
In her, yes. If a social worker is working in a hospital setting and somebody's hospitalized and, and they're calling in a social worker, that role of the social worker is oftentimes resources, connecting them to maybe a bridge to a mental health provider out in the community. And so I think the setting of the social worker does make a difference. In general, a clinical psychologist is going to have usually a longer training period of education. But Stephanie really is one of our unique colleagues in that, she is an expert in working with patients with gastrointestinal issues and in delivering mental health services. But that is a very fair question that somebody in the community, if you're looking for someone and you're looking at different degrees, you would want to ask that provider, what is your experience working with patients with chronic illness? What is your experience working with a patient with IBD? Do you know the difference between IBD and IBS? And also, what evidence-based therapies are you using?
Right.
And you should ask that to anyone that you're working with, not just somebody that has a social work degree, but a clinical psychologist also may not have training in working with patients with chronic illness. So if you can't find a GI psychologist or a GI mental health provider, the things that you want to look for in a mental health provider are people that are using cognitive behavioral therapy, that have expertise working with maybe other chronic conditions. So maybe they have a cardiology background or oncology or headaches. There are people that have worked with patients that have other chronic medical conditions, and our brain gut behavioral therapies tend to fall under cognitive behavioral therapy, acceptance and commitment based therapy. So you'll see the acronyms ACT or CBT, and gut-directed hypnosis is another strategy that we utilize with our patients. So if that provider is able to describe some of those, then you're probably on the right track. Also, people that manage chronic pain, anxiety, depression, those also are likely going to be a good fit for somebody that is managing a gastrointestinal condition.
That's really valuable, I think, for our audience. It's really valuable to know what kind of questions to ask. And it's not just about the title, but it's actually about the experience of the person. In Stephanie's case, if you train people to address other social workers, there could be, because I'm thinking about scalability with the 400 licensed psychologists, not going to be able to cover. And the extensive education is somewhat preventative for many people. So
and that is something that we're seeing happening. Is there's a lot of us across the spectrum of IBD and mental health care and extending to all of GI conditions. How do we scale what we do?
Right.
And so in situations where there's a medical home, which means that, in an academic institution or a large hospital setting, you are getting that connection to a mental health provider with your gastroenterologist that works with your primary care doctor, that works with a dietitian. And oftentimes it is, social workers or master's level clinicians that are delivering some of this evidence-based care that has been, in some cases, it's manualized. So we can go through modules of coping skills, stress management, navigating the medical system, communicating with your doctors. And so there's a lot of ways that this field is growing and evolving right now, with all of us having our scalability and improving access hats on, and how do we extend that to people that are in need?
Yeah, I would just add that there is such a shortage of mental health providers in general. And then if you go diagnosis specific, there's a shortage. So I would also encourage patients, make a list of questions. If you want, go through, there's a list on the Crohn's and Colitis Foundation. They have mental health providers, not very, a lot of them are cross-referenced with the RomeGIPsych.org. But then also, if you can't find anyone that takes your insurance or that has like less than a year-long wait list, I would say that something is better than nothing. Get on someone's wait list, but also get a generalist. You can search on Psychology Today, and that is, again, it's not perfect, but there's bios. You can search by your zip code, by chronic illness as the issue or chronic pain. But you're going to have to, it is a process. You're going to have to put some time into calling these people, seeing if they have an opening, seeing if they have virtual appointments if they're not super close to you, but they're licensed within your state. So I really wish it was smoother and easier. for people to access it. So sometimes just try and get a loved one to make some of those phone calls for you if you're already really struggling and don't want to have to like interview these different providers to find a good match. But it is so worth it. And they're, you know, ultimately
Tina,
we just want people to get the care.
I wanted to just add something to that. Stephanie, what you said made a lot of sense. So for me, what I've done over the years is initially I was in New Jersey living with my mom. We found somebody in New Jersey who could understand Crohn's disease and inflammatory bowel disease in general, because at the time I had been diagnosed with ulcerative colitis. And she helped me with a lot of the acceptance and coping tools. But then when I moved to New York, something similar, I actually asked my GI at the time who she recommends. And then I actually spoke to the psychologist, and she told me her background, and she told me she does work with patients with chronic illnesses and has worked with many IBD patients before. So yes, she's a generalist, but she's been able to help me. My doctor also referred me to a psychiatrist who works in the liver transplant department. Close enough, not quite there, but she totally gets IBD and ostomies. So I am working with, you know, generally more general practitioners when it comes to therapy, or somebody who's a little specialized in something a little different. But the idea is that there are people who are qualified in helping us, regardless of the chronic illness that we have. I also do go to an IBD center that has a medical home, as Dr. Riehl was referring to, and I do check in occasionally with the GI psychologist, maybe 2 or 3 times a year, because I realize other patients need her and I have other practitioners who can help me. So there are ways to work around this.
That's good. That's great too. What I wanted to add to that was, and maybe ask all 3 of you, you know, as a final question, really, we've talked a lot about live sessions, virtual sessions with real people, but there are a number of companies out there trying to build apps to deal with some mental health issues, especially for IBD. You know, we have a few, and one in New York, and there are quite a few outside as well that are gaining traction. Is that something that you recommend from both you and Tina, when you probably have spoken to patients or used them? And
yeah, I have. There is one that I have heard from multiple patients about, called Trellis Health here in based out of New York, but really available to Canada. Yep. So I do think there are ways to, I mean, I do want to ask Stephanie and Dr. Riehl about resources, but I do think that could be a potential resource for patients who might be in rural areas without access to psychologists or dietitians to, you know, supplement their care.
Yeah, this is a growing space, and Karin, this and Tina, this hits on this access. So Trellis is certainly gaining traction, and I think is going to deliver certain aspects of evidence-based care and almost bringing a IBD home type experience for patients virtually. I think that's what patients are looking for. Mm-hmm. You know, one of the programs that I'm a part of is GI On Demand, where we recognized that we couldn't offer one-to-one behavioral therapy services to everyone. So we've created webinars with content to help guide patients to what their next steps may be, learning about some of these things that we've talked about. There's also apps out there that are delivering very specific gut-directed services. Mahana, Nerva, Regulera. There's lots that are emerging, each with different go-to-market kind of strategies, meaning how they're going to get to the patients and what a patient will need in order to get to them. Sometimes will involve their physician. So I am doing a lot of education of physicians right now that they need to be aware of what's on the market because their patients are going to be asking them. Yep. And I would encourage patients to, you know, ask your doctors about them, because if a patient is in need of individualized one-to-one therapy, I don't think any of these are going to be a good resource for you, or a substitute for helping to stabilize depression, anxiety, if it's in the moderate to severe range. So if that's you, then we need to keep working together as a team to find you in-person mental health care, virtual care that's delivered one-to-one. But if you're somebody on a wait list, or you maybe have concluded treatment with a GI mental health provider, or your general mental health provider, and you want some additional education, resources, tools, I think there's a lot that we can gain from using some of these virtual therapies, but I do think you should be talking with your providers about what you're thinking about using.
I think that sounds really realistic. Any final comments, Stephanie, on the virtual, on the
Sure.
apps that are coming out there?
On the apps, I would just echo that, yes, there's room for all the apps because there's so much demand. I would also say that both of the national organizations have a lot of great resources that aren't app-based. The Crohn's and Colitis Foundation have, you can search for support groups in your area. Now with, the pandemic, a lot of them meet virtually. There's specific ones for pediatric kids, for teens, for college students, for, there's the United Ostomy Association of America, UOAA. Again, they have specific groups. There's a Facebook group called Girls with Guts, specifically for women with IBD and ostomy. So trying to figure out what is the modality. I agree with Dr. Riehl that if you have a certain level of need, it is always better to get evaluated in person, to talk with your doctor about how do I get this more immediate. But these are great ways to supplement and there's a power of two, find a mentor, another patient that has similar, whether you're a caregiver or the patient. There's all sorts of groups and supports online through those two national organizations that can kind of supplement the apps as well.
This is great to hear. It's really great to hear. I mean, there's a need, there's a huge demand out there. There's, I think, a scientific, medical, really proven need for it. Unfortunately, we don't have a person for every person, and especially not located in a place where it's easy to go and see that individual. But finding support groups that make sense to you. And I think, Tina, you are a mentor to so many. So the three of you are doing so much. We have launched IBD Life, where we think that there is support as well. And Girls with Guts, she's actually part of it. So we are excited about building a place for people with IBD and also IBS to talk to each other, just freely discuss. And that's the beginning of everything, right? You open up. But I think we've learned a lot today about how to cope with mental health. I mean, I don't think we have fully reached the point of how you become resilient, but it's a lot of hard work. That's one thing I've taken away from this. There's a lot of hard work and a big time commitment. Any final comments, Tina?
I think that this was an excellent session. I really, really appreciate Stephanie and Dr. Riehl coming together to share sort of all these wonderful resources, but also why taking care of our mental health is just as important as taking care of our physical health with IBD. And I thank Lifebulb for recognizing the need for a session like this. We thank you all for joining us today, and we look forward to future sessions. Join us for our next session on October 5th on treatment and management of IBD surgery. Thank you all so much, and see you next time.
Thank you.